Hey friends, welcome to Yoga for Dentists. I'm Dr. Josie DeVideo. I'm a longtime dentist, registered yoga teacher, and certified wellness consultant. Today, I'm chatting with Dr. Houri Fatourachi, who is a pediatric dentist in the San Diego area. And I really am intrigued by her story. That's why I brought her onto the show, because at the ripe old age of 38, she had a heart attack that she contributes to sheer stress. So we're going to dive into that and see what led to that, what she's learned from that. And I'm hoping that she'll have some pearls of wisdom to share with you, our loyal listeners, so that you can prevent, the consequences of stress. So Dr. Fatourachi, welcome to the show.
Hi, thank you so much for having me. It really is a pleasure. Thank you.
So let's start with you sharing a little bit about how you ended up in dentistry, because you were born in Iran.
Yeah.
And so tell us a little bit about that experience and
Yeah.
how you ended up being a pediatric dentist in San Diego.
In California, yeah. So I was born and raised in Iran. I came to the United States when I was 20 years old. I entered the University of Missouri in Kansas City's 6-year program, and I got my bachelor in biology and the DDS in 6 years. Then I went on. Then I hated the dentures more than anything else.
Many
No,
people
literally.
do. Many people do.
More than anything else. And I was like, what can I do so I don't ever have to do a denture? And I was like, it's the pediatric dentistry. No, really, seriously. Like my last denture case that, because we had to do like 3 cases. And on the last one, I went up crying to our attending and I said, sign me off on this. I promise you, I will never do another of these for the rest of my life. So that's how I ended up being a pediatric dentist. No, but I love kids. I do absolutely love kids. I think they are so much easier to work on. You've never have an adult that you do a pulp and crown on them, and then afterward you give them a bouncy ball and a sticky hand, and they'll be excited about it. It's just like you can't do it. So you can't beat that. So I mean, I finished in 2001, and then I moved to San Diego because my sister lived in San Diego, and she's the only other family I have in United States, like a close family. My parents are still lived in Iran, and my other sister also at the time lived in Iran. So it was just me and my older sister. So I came to California to be near to her. And for a while, like we practiced together, but then she's also a pediatric dentist. And but she's like 10 years older than me, had kids, younger than me. And we practiced with each other for a couple of years, but then I really realized that I do want to have my own practice, and then this is really better just for both of us. And it's sometimes you have to do things to learn from it. And I like my relationship with her, like our sister relationship, meant so much more to me than us practicing together, that I thought if we each have our separate practices, we can just be better sisters too.
Right.
So I went on to open my own practice, and then I said, oh well, if I'm going to start, I want to like own my building. So I started looking for places, and I bought a space in I started like looking at it July of 2008, and it was finalized in August of 2008. And in September of 2008, if everybody remembers, all hell basically broke loose. It was that huge crash, and I was the first person that bought the space. It was new buildings that they were building, and I was the first one. And when I bought it, I was told that, oh, you're gonna have 4 people have bought it, 4 in a contract. You're the number 9. Once everything was said and done, I started construction in November, like October, November, and there was nobody there. And nobody came for another year. So I sat in an empty parking lot by myself, trying to open a startup business when there is no traffic, when everybody thought that was a deserted parking lot. And this was 2009. And at the time, we only had one daughter. We had a 4-year-old. And really kind of like we're told, well, you can't really have any more kids and without some maybe infertility treatment. And we were just really content just having one. And then I was like, okay, so my practice would be my second baby, And comes 2010, and we get a surprise pregnancy. And I get pregnant with my second daughter, which was, she is just absolutely, she's completed our family. I wouldn't change a thing about it, but it was stressful because I had a startup business who wasn't making ends meet, who was in red. I was pregnant. I couldn't even afford to bring an associate. I was, locked into a mortgage at the time with a 6% interest. I couldn't even, there would be months that I couldn't even make the mortgage in the office. So I had to have associate jobs. And then I had to cut in everywhere I can while I'm still pregnant. So I used to work 3 days in a different office, and I would like drive around like a mad woman, drop off my 4-year-old in daycare, and then I would run to work, or like sometimes, I would schedule patients whenever time they wanted to. They're like, oh, I want a 7 o'clock appointment. I'd be like, give it to them. Like, we need to see patients, give it to them. And I would run in the middle of my day. I would go pick up my 4-year-old from daycare. At the time, she was 5-year-old. I would pick her up from preschool daycare to not pay the extra $10 an hour after care because it mattered,
Yeah.
And then I would bring her to the office. I had a futon that that kid fell asleep on that futon so many nights without dinner.
Mm.
And because I was just catering to people, trying to float this practice, trying to not go bankrupt, trying to not lose it while being pregnant, high risk pregnancy too. So comes in March of 2011. She comes in 10 days early. I was supposed to work till end of March, like first week of April, and she was supposed to, her due date was April 8th. And I hadn't had anything washed. I wasn't ready. The crib wasn't set. I still had patients the next day. I remember I went to the hospital, it was my water broke. I went to the hospital and I called my assistant 6 o'clock in the morning and I said, cancel the morning appointment. I'm in the hospital. I think my water broke. And then she turned to me and she said, what do you want to do with the afternoon ones? I'm like, yeah, I think you should cancel the afternoon ones too. So just sheer stress. And and then while I had her, I had like this, the last week of the pregnancy, I also had an upper respiratory infection. I was like coughing. This is like pre-COVID time in the hospital. I got like my own room and it said outside of it, contagious, quarantine, like nobody could come in.
Wow.
Because I was sick the last week. And she came home, we brought her home, and I took like 2 weeks, 3 weeks of the maternity leave. And then I was like, I have to go back because I've got this other thing that is, I'm going to lose it. If I don't go and see these patients, I'm going to lose this practice.
At that point, when you went back, how old was your practice?
At that point, it was 2 years old.
Okay.
And it's still in red. It's still not breaking even. At that point, it's still me working at the second job to really just pay the bills of this one. I'm not even taking anything home. It's still in red because I had a huge mortgage. I had really high interest in both of my loans. They weren't refinancing me because I wasn't showing income.
Hmm.
And I couldn't really be in the office to do more, like try to I didn't have money to market because whatever I was making, I was paying the mortgage.
Right.
So it was just like kind of like it was a vicious cycle. So at this point, I have an infant and I have a 6-year-old. And I was always the mom that said, oh, if I have a second kid, everything I do for the first one, I have to do it for the second one. It has to be even. And then my first one had her hand and foot printed on the ceramic, or like this, like the molds that, make it. So one of these days, like it was 8 weeks after I had her and it was already late because the other one was like done sooner. My in-laws were here like helping me because I would go back to work, for 4 hours in the mornings and I would come back and stay with the baby. And then, or like one day I would go in the morning, one day I would go in the afternoon and, this whole thing trying to make this work. And then one morning I told them I've made an appointment. We're going to go and then take the baby's hand and footprint right here in the mall. And then my mother-in-law goes, okay, like we don't really need diaper bags and anything. Let's just go. And I was like, yeah, let's just go. And then I go in, and then because we didn't expect, we weren't expecting to have any more kids, I gave all my stroller, high chair, all of those. Like we had to buy all of these new. And this is like the first time I was going with the new stroller, and I didn't know how to open this stroller. So we take the stroller out of the car, and me and my, father-in-law were like trying to open this stroller, and I couldn't really open it. And I get like this really sharp pain in my chest. Like it feels like somebody has just stabbed a knife in my chest and it wouldn't take it out. And then I was like, oh, I gotta sit down for a second. I think I pulled a muscle. So I go sit down in the car, and my mother-in-law is sitting next to me, and she sees that I'm getting, just not feeling good, and I'm just getting more and more pale. And then she turns to me and she says, can you please call someone, because I'm afraid something happens to you and I wouldn't know who to call and I wouldn't know what to say or to tell them where we are. Can you call while you can still tell them where we are? And I was like, no, I'm okay. I'm going to be fine. We'll go home in a second. Let's just go do this. And she's like, no, can you just please call someone? So I call 911, like thinking, this is so ridiculous. I don't need to go. I have patients this afternoon. I don't have time to go to the hospital right now. And so the 911 comes in, the firefighter come in, ambulance comes in, and then they like take my blood pressure, and they're like, you're not going anywhere. We're taking you to the hospital. And I'm like, no, you're not. I've got an infant. I've got a 6-year-old. I've got 2 elderly in-laws with me. I'm the driver. No, you're not taking me anywhere. They're like, oh, no, we're taking you. And they're like, oh, we can't bring the baby with you. And I was like, no, but what am I going to do with the baby in the hospital? You're going to lose her. They're like, okay, so then your mother-in-law can come. And so my mother-in-law sits in the front. They put the baby in the back. And all I do is just like call my husband and I tell him, I'm going to the hospital. I don't really think it's a big deal, but your dad and Ariana are in the parking lot of Outlet Mall. Just go and get them because I had to leave them there. Like they're not letting me go anywhere. That's the only call I make for him. And I'm like, just go take them home. Like I don't want them to be deserted. And he's like, I'm like, don't worry about it. It's okay. It's no big deal. So I go to the hospital and then I like get in there and then my chest pain isn't going away. And I have nurses. I had 3-4 nurses. Like somebody is just like taking off my clothes, and then the other ones are putting all these sensors on me. And I am like looking around and I'm like, what is going on? And then I turn to one nurse and says, am I having a heart attack or something? And he goes, yes, you are. And then I was like, oh. And you know what I think at that point? I'm like, I have patients this afternoon. I have to call the office and cancel the appointments. So he's like looking at me like, you're really stupid. Like, seriously, I just told you you had a heart attack. You're having a heart attack. And I'm like, no, can I have your phone? So I get the nurse's phone and I call the office and I tell the girls in the office, I'm having a heart attack. You need to cancel the afternoon appointments. And then they're like, wait, what? And then the nurses just grabs the phone from me. It's like, we don't have time to talk. We have to take you to put the stents in. And then I have like this surgeon comes in and he like talks a whole bunch with me. I don't really remember what he says. I honestly don't, because at that point I'm like, what are you talking about? I can't have a heart attack. I'm 38 years old. I just had a baby. What do you mean I have a heart attack? So anyways, after that, it just kind of like once everything settles in, I get 2 stents placed in. And it really hits me that I don't really know what was the cause of it, but I know that I was never that stressed ever in my life. I think it was just that trying to manage a practice, manage a 6-year-old, handle it, high risk pregnancy, worrying about, am I going to be able to make this mortgage next month? Like I was never that stressed in my life. And then I had a few of our friends that they came and talked to me. Like, I had a friend who is a, physician assistant. And she said, do you know how lucky you are? You're here. It's not atherosclerosis. I don't really have high cholesterol. It was more like a blood clot that it was, that it, they said postpartum you would have, because you have all these clotting factors in a really high level. So it was a blood clot. So do you know that if blood clot, it was in the posterior artery of my heart? And she said, do you know it was on the anterior artery, it would have been a sudden stop of your heart. And then there would have been really no reviving you and you would have been like gone. Like, it's like, do you know how lucky you are that it happened to where it happened, that you still had the chance to breathe and be able to have people to come and get you and take you. So I really, really told myself, this is it. This is my second chance in life. And I have 2 kids and they don't really have anybody else besides their parents here. I mean, they have an aunt, but there's no grandparents, there's no cousins, there's no extended family. I'm it. And if I don't take care of myself, maybe next time I'm not so lucky.
Right.
So I really changed my perspective about the practice, about my priorities, about how I run things. And I just started saying, you know what, just going to use the savings till I figure this practice out. So we'll see what is going on. I'm just not going to stress about it. I am going to work the hours that I want to work. I'm not going to work at 7 o'clock at night. I don't really care if people want an appointment at 7 o'clock at night. I'm not going to work my weekends. I'm going to make my kids a priority. And I am going to do dentistry when I'm not a mom.
Right.
And somehow, once I did that, my practice blossomed too. It was just like once I was able to just kind of put my foot down and say, this is it. Like, now that I didn't die, then I'm going to make it to every field trip. Then I'm going to make it to every class party. Then I'm going to be present. And then when I'm there, I'm going to be there. I'm not going to think about it. And then when I leave the office, I'm going to leave the office. And I'm just not going to bring that stress with me home, because it is what it is. You know, there is so much I can control. And I really made peace with myself. I made peace with the fact that I can't be everybody's dentist. I made peace with that. I don't have to be the highest producing pediatric dentist in San Diego. I don't have to be the busiest office. I don't have to be any of that. I also made peace with the fact that there are things that I don't have to have. I don't have to have designer bags. I don't have to go to, luxury trips. There are things that I'm going to cut, and there are things that I'm going to keep. But more than anything, I'm just going to want to be present. So when I am doing things with my kids, I'm going to be present. I'm going to be the fun mom, because at the end of the day, do I really want to leave saying, gosh, I wish I did 1,000 more prophies in my life, and I fixed 2,000 more class 2 amalgams, and I just or composites, or I did so many more hope and crowns, or I wish I did 10,000 space maintainers? Or do I want to say I went on every ride in Disneyland with my kids? Or I want to say that I was there for every field trip, that I was there for every class party, and that my life meant something more than just me trying to run this wheel of this office. I just really stopped making the office the focus of my life, and then just making it be part of it. I still care very much so for it. I still call it my second baby. I call it my most demanding baby. It really is. And it really is the most demanding baby. I still care very much so for it. And when I am in the office, I am fully attentive to my patients, to the parents. But when I leave, I leave.
Yeah. And that's the way it should be. Right. And I think what happens is a lot of people develop this mindset, because we're, sort of how our training goes. We're trained, we have to, score high scores, be the best at this, be all of the things so we can get into dental school. And then in dental school, it sort of exacerbates that tendency to try to do all of the things and be perfect at it, so that we can either go to specialty school or, develop this really nice practice. And we get stuck in these mindsets that slowly get distorted over time. I mean, think about what you were saying. You're having a heart attack in the ER, and you're concerned about your afternoon patients. And your patients, if they're just not feeling it that day, they're going to cancel. They don't care what you have going on, right? And so there's definitely a mindset disconnect, and you're not the only one. I mean, in my work with my clients in my wellness program, there's a lot of distorted thinking. I suffered from this too. It sounds like you figured this out. Ultimately, what you say is most important to you should be reflective of how you spend your time and your energy. Right.
Yeah.
And so you have to reevaluate these things, because you are only given one life, and you don't know how mismanaged stress is going to show up in your life.
Yeah, no, very true. every single time I talk to a new mom or a new dentist or anyone, they always tell me, how do you do it? I get this asked a lot. My mom friends always tell me, they're like, how is that? How do you run a practice, but manage to show up in every single field trip? Like, how is this? I said, beginning of the year, I get the PTA's schedule. I get the schedule from the teacher, and I will sit down in my office and I make blocks. And I do make blocks. I'm like, February 12th, jogathon, block for 2 hours. It's just that I do make blocks. I mean, my kids, I still feel like, there are times that, I miss being with them, but at the same time, I really try to make the most out of it. I don't ever work on my kids' birthdays. I don't work the last day of the school, so I pick them up from school. I don't work the last day of summer. So even if they don't spend the entire summer with me, I make sure the last 2-3 days of summer, I'm there and we're doing a ton of fun stuff. So that when they're done with it, they're like, oh yeah, I had a fun summer,
Right.
So I don't work the last few days of the summer. I don't work the first day of the school. I used to not work the first day of school at all because I used to drop them off and then I was like, oh, just be a couple hours. And I'm like, oh, I'll just want to go out to breakfast or something with other mom friends. I just want to be like the rest of the moms. I want to be able to
Right.
just go and have, brunch with everybody else. So I would just like not work the first day of the school. So I can go ahead and pick them up myself. So I
Yeah.
can go ahead and drop them off myself. I can go ahead and pick them up myself. If I can't pick up every day, I mean, I drop off every day. I can't pick up every day, but I can pick up at least the, first and last day of the school. I don't work on their spring breaks. I'm a pediatric dentist, but the spring breaks are like the time that I make supposedly a good production, but I also get 18 spring breaks with my kids.
Right. Right.
That's it. I don't get infinite spring breaks.
Right.
Not even 18, 12. I
Right.
get 12 spring breaks with my kids. So I don't work them. Christmas, I work between Christmas and New Year, I work about 5 days. Again, as a pediatric dentist, people think like, you're crazy. I'm like, not really.
Yeah.
It works. I work really hard for that 5 days. And it's a compromise. It's a balance, like I'm not taking the entire entire Christmas break off, but I'm taking enough time off for them to feel that, okay, we had a winter break with our mom and with just everything else. And then I started taking holidays off too when they were off, and I just took off too. Like I don't work President's Day weekend. I don't work Veterans Day. I just don't. If they're home, I'm home too. At the end of the day, is this really the smartest business decision? Maybe not, but is this the smartest life decision? Yes, because again, I get 12 of those.
Yeah.
My oldest is off to college this year. My younger one is in 6th grade. So I got 6 more spring breaks. I got 6 more President's Day weekend, Veterans Day. That's it. And then after that, when she's gone, I can go ahead and work those days. It'll be fine.
Right.
Like, nobody's stopping me.
It reminds me of something, I wrote an article years ago about my experience in raising my kids and having a practice and taking time off in order to, be with them and adjusting my schedule accordingly. And back in the day, one of my colleagues, a male, of course, said, what are you doing? You're taking so much time off. You're, committing practice suicide. And like you said, as a business decision, it probably wasn't the best. But what I told him was, I can always regrow my practice. I cannot re-raise my kids. And that is what's important to me. And so for now, I'm going to arrange my schedule so I can be there as much as I want to be for my kids. Obviously, if you run a business, have a practice, employ other people, I couldn't completely throw in the towel. I had to be there a certain amount, but I did arrange my schedule enough to be able to raise my kids. And that sounds like you did the same thing. Here's what is important for our listeners to understand. In order for you to be able to make that decision, you have to come to terms with the fact that, like you said, you can't plan on being the highest producer in your region. You can't plan on, having, all kinds of money to spend on luxury items, exclusive things. It doesn't mean you're living like a pauper, right? But maybe you're not living up to the standards that you see on social media, or what other people tell you, or even culturally what people expect of you if you're a doctor, right? And so you have to come to terms with that so that you have freedom to make decisions. Because I often hear of a lot of dentists who are living beyond their means, ultimately.
They're keeping up with the Joneses.
Keeping up with the dental Joneses.
Yep. Absolutely.
Right?
Absolutely.
Yeah. And for what? For what? So they can have stress, so they can't, relax on vacation or take time off because there are bills piling up because they've overextended themselves. And so that's what creates the stress.
Yeah, it absolutely does.
Yeah, not knowing what's important to you and then acting in those ways that reflect what's important to you. That's what creates the stress. When you're living outside of what's important to you, that's what's stressful.
Yeah, no, absolutely. And then, in my case, it wasn't so much that I think I found myself in a situation that I really wasn't anticipating. It was just, for me, it wasn't really my goal. It was like opening my own practice wasn't so then I'll be the highest producing dentist, and I wouldn't be any of that. But the part of it is that also I think I was naive. I was very naive, and I was a little arrogant too, probably, as a young 35, 36-year-old. It was like, I can't take just a big loan. And no, you can't. It's just that it was an unrealistic amount of loan that I took on. I bought the space in the height of the market, and then it crashed. And I was stuck with all these like high interest, loans. And it's just that part of that, it was just like I wasn't really like planning to, have all this, luxury this or luxury that. It was more like I almost like found myself in a situation that I was like, how did I get here? Like, this isn't what I wanted. Like, how did this happen? And then I know how it happened. It happened because I was naive, and, I didn't do my due diligence. I didn't do my homework. I just took people's words for it. Oh yeah, you're the number 9 business coming in. Like, can you give me the list of the other 8? I like to know who they are. I want to know who my neighbors are. Like, why did I just believe them? I mean, the day that I opened my doors, I was $400,000 underwater. I was like, how did I get here? And I think just the sheer stress of that, in being able to just say, okay, now I started something. Now I can just like throw in the towel and say, that's it, I'm done. Then what am I going to do? Then do I file bankruptcy? Do I give this up? It was just, I mean, there were days that I would like, and I had like very little stuff. I had like 2. I couldn't really afford stuff. For the first, I think I want to say 4 years, I did every single cleaning myself. I would see like 2 families at a time, and I would like tell them, okay, have a seat. And then like right in front of them, I would clean the chairs. I would sterilize. I was just like, I was a one-woman show, which I mean, in a lot of ways, I think it was very humbling, because not every time I hire a new hire, I always tell them, I say, there is nothing in this office that it is beneath me to do. So therefore it is not beneath me to do.
Right.
So
Right.
there is no, this is my job, this is your job. I mean, I do everything. If we need to clean chairs, I'm going to clean chairs. If we run behind in a sterilization, I will go and run the sterilization. Like, I had to learn ins and outs of all of it. And I think part of like where it got me, I think it was just like me being naive and not doing my due diligence,
Right.
and thinking, oh, I'm a dentist, I'm just going to go in and buy this and it's just going to happen. I'm just going to be able to pay it. And it's just sometimes, the hardest lessons in life are learned the best way. So,
Right.
and that's just really what it is. So I just had to pay a really high price for mine.
Yeah.
Yeah.
And luckily, like you said, you got a second chance.
Yeah. Yeah. It was yesterday. My anniversary was yesterday, 12 years.
Wow. Well, congratulations.
Thank you. Yeah. 12 years.
So if you could now say something to your mid-30s self, based on now what you've gone through, what would you say to that person?
I would say, before you do everything, talk to a lawyer. Just don't think you know everything. If you're making a purchase that big, get a lawyer, have someone look at it, ask for advice. Don't think that you're invincible, that nothing would happen to you. And make yourself the priority. Yeah. Also, don't run around like a crazy person trying to think you can clone yourself and then be in like 6 different places in one day. It was just also don't do that. Because I did that a lot. I would just be like, oh, and today I'm going to do this and this and this and this and this and this. And I'm going to go pick her up in the middle of the day, bring her to the office. And then I'm going to do the rest of this. And we're going to go do this afterward. And then it was just like, there's so much your body can take. Like, appreciate your body for whatever it can do, but don't overuse it. And
Yes.
don't abuse it.
Right.
So,
Yeah, we want to be super women.
yeah.
Right. And so we feel like we want to do it all. And maybe we do, and maybe we can, but that doesn't mean we should.
No, that doesn't mean we should. No, just because I can have a associate job and run my own office and then pick up and drop off a 6-year-old and then also do the groceries and then also, want to like take her to like Legoland every weekend and then just come and make dinner and also balance the book in the office and also figure out, oh, how many new patients we had this month and then what do I need to do and how do I need to advertise this? Like, it's okay. It's okay if laundry's not done. It's okay if your house is messy. It's like sometimes those things are just okay. It just is okay. It's not the end of the world. And it's good to delegate, just delegate. Like and then now that's the other thing that I did in the office. It's just like hire people that you trust, just have like those boundaries. I think being able to let go of controlling, having to control everything.
Yes.
I think that's really important. And then also letting go of guilt. I think guilt is such a wasted feeling because and that's the other thing. I think part of my stress was also every time I was in the office, I felt guilty that I was missing my kids. And every time I was with my kids, I felt guilty that I was abandoning my practice. So
Right.
I felt guilty all the time that I am not neither a good mom or a good, business owner, practitioner, dentist. Like I felt like I was inadequate all the time. And then I really let go of that. I was like, you know what? I'm good enough in both of them for whatever it is that I can do.
Right.
Just it is what it is.
Right. And that's very profound because that is the conundrum that female healthcare providers find themselves in, right? Especially business owners. You always feel like you're not giving each thing your full attention.
Yeah. But we are though, we are. I think just like you said, guilt is such a wasted feeling.
Mhm.
Like I really stopped feeling guilty. Like I said, I would make it to most of it, but they would be like, if the jogathon would get reined in and I would move it, then I had patience that time, then I wouldn't feel guilty about it. And I'd be like, you know what? It's okay. I don't have to see you, run 5 laps this year. I'll watch you next year. Like I had every intention of being in there. I can't control the weather. Like, and
Right.
I'm not going to feel guilty about it. And it
Right,
is
right.
okay. It's like I really had to make peace with a lot of that. And then when it just became something important, it was just a matter of priorities, but or if I got an last minute email that she's the student of the month and then we're having an award ceremony for her at 11 o'clock on the Thursday morning and I had patients there, then I did move those patients and I said, you know what, I'm gonna go watch her get this character award for perseverance because
Right.
that's important to her. It's different than me watching her run 5 laps. So it's also just deciding like that it's okay to give in a little bit to the other one and then just kind of managing that balance without having to feel like, oh my God, I have to be, everywhere all the time.
Right. Yeah, because we tend to be all or none thinkers. So I either want to go to all of the events or I'm not going to go to them. And we have to, like you said, just be okay with there are ones I can go to and I'm going to make every effort to go. And then there's ones that maybe aren't as important for me to go to.
Yeah.
Absolutely. So what does life moving forward look like for you? I know you said you have a daughter in college and one 6 years younger.
Yeah, she's heading to University of Washington in Seattle.
Perfect.
And I have a 12-year-old She's kind of the same age as my heart attack. I had it when she was 8 weeks old. So yeah, so
Right.
I have a 12. So I have 6 more years with her at home. Honestly, it's just like the future is like I am going to do the same thing that I did with the older one, with the little one. I mean, being in middle school and like, and then high school next, they don't really need you as much out of school. So it actually kind of, I feel like even from this year, I was able to have like a lot more time in the office because I wasn't really, there was no Christmas parties or Halloween parties or, any of those. Like we're kind of like over that. So definitely it's opened up a little bit of a space for me there. But I absolutely intend on my daughter she also made the University of Washington's dance team. So, and she's super excited about that. She is like, she's been dancing for like 14 years. And this was like a dream come true for her. So I'm going to be Alaska Airline frequent flyer. Like, just like there's gonna be some weekends that I'm gonna fly on a Friday and come back on Sunday morning because I want to go watch the game and watch her dance and
Right.
meet up with her when she's gonna be, because she's part of a Division I competitive team there, so she's gonna be competing nationally in Florida in January. So I'm gonna go there. So here comes another weekend that is just gonna get marked up in my schedule for the next 4 years because
Right.
it is what it is. That's just important. And I honestly don't see myself changing much. I still have to work because, we have to pay for college and then a wedding after that probably. But not, not soon. Not soon. That's the problem with girls. See, you have boys, you don't have that problem. You only pay for college. And so I still have to work. And I love dentistry. I absolutely do. I love doing what I do. I can't imagine doing anything else. I think it's so rewarding. And like I said, pediatric dentistry is just fun. I love kids, I don't I don't have to talk politics with them.
Right.
I mean, we can talk about Bluey and they'll be happy. Like, I mean, how great that is, it's wonderful. Like they don't have to they don't worry about recession, it's awesome.
Right.
And I love kids. I think it's so rewarding and I just love doing what I do. So I see myself practicing for at least, I want to say 10, 15 years, because it's not straining, it's not putting pressure on my body. I am not, killing myself doing it. So I can see myself doing it for the next at least 10, 15 years if I'm allowed, if nothing else happens, because life is so unpredictable. If I'm allowed, yeah, that's what I see. With some, frequent flying to between Seattle and San Diego.
Dr. Houri Fatourachi, pediatric dentist in San Diego, thank you so much for sharing your story, sharing your mindsets, your wisdom, and what this journey has brought you, how you've adjusted your life so that you can continue to do it for another 10 or 15 years. Thank you so much for being a guest on the show today.
Thank you so much for inviting me. It was a pleasure. Thank you. Yeah.